I now give the floor to His Excellency the Secretary General of the United Nations, His Excellency Ban Ki-moon.
Thank you, Your Excellency. Mr. Sam Kutesa, President of the General Assembly, Excellencies, esteemed colleagues, Special Representative Ismail Ould Sheikh Ahmed, and Special Envoy Dr. David Nabarro, ladies and gentlemen. As you know, last month, I traveled to Liberia, Guinea, Sierra Leone, and Mali to show my solidarity and that of the United Nations with the governments, communities, and people affected by the Ebola outbreak. I also visited UNMIR headquarters in Ghana. I held extensive talks with the presidents of these countries. I met with the courageous responders on the front lines. I was inspired by the hundreds of people working tirelessly to coordinate these complex response operations. I was deeply moved and humbled to meet the resilient people and communities affected by the outbreak, including survivors who are now helping others who have become infected. They are all Ebola heroes. I left the region convinced that we can defeat this outbreak. Our challenge is to prevail quickly and minimize suffering. And this demands collective determination and clarity of focus by all. Excellencies, ladies and gentlemen, we have worked intensively to support the people and nations confronting the Ebola outbreak. Together, we mobilized to assist the affected countries as they led the response. Many nations contributed funds, supplies, and expertise. You boldly welcomed the UN mission for Ebola emergency response, the first ever UN health emergency mission. Today, 4 months later, we can report progress. A strong national leadership combined with local community engagement and international support is slowing the incidence of new cases in many places. Liberia, once the worst affected country, has seen the most dramatic improvements. In Sierra Leone, Operation Western Area Surge has helped reduce incidence. In Guinea, numbers of people with Ebola are comparatively low, but are geographically dispersed. In Mali, an early and rapid response has strengthened national contact tracing and containment capacities. Mali has now been declared Ebola-free. And this work must be maintained, and we must remain vigilant. Through all our efforts, we have learned that our response must be regional in nature to avoid the risk of retransmission. The outbreak has taught us that there is no room for complacency. We have also learned that our response must evolve to match the increasingly dispersed pattern of the outbreak. Throughout the 3 affected countries, the response is becoming ever more agile, mobile, and flexible. People with Ebola are being detected and brought under treatment. Their contacts are being traced and kept under surveillance. Education and health services are being restarted with a focus on supporting infection prevention and control. Massive support from the international community has been critical. Yet, resources continue to be required to adjust the response, monitor chains of transmissions, and end the outbreak. My trust fund has been depleted to fund the priority gaps. It needs your continued support. I call upon all member states to sustain the tremendous momentum we have achieved and continue prioritizing the response. At the same time, the UN system, through UNMEER, will intensify its efforts under the leadership of my new Special Representative, Ismail Ahmed. The affected countries are starting to assess recovery needs and to prepare for post-Ebola life. I have instructed the UN system to begin, in parallel with the response, work on the restoration of essential services and planning for early recovery. We are focusing on access to health care for common illnesses, food security, reopening schools, and ensuring care for orphaned children. The revival of societies also needs attention. The virus has eaten away at the fabric of society, at how people live, how they love, and how they die, and care for loved ones in their final days. It has led to those affected being unfairly stigmatized. We must collectively take stock of how we can build a longer-term resilience to withstand the future outbreaks. We owe this investment to, first, the millions of people across West Africa whose lives have been disrupted and devastated by this outbreak. Second, to the hundreds of healthcare workers who have perished in treating the infected. And thirdly, the thousands who continue to risk their lives in doing so. That is why I'm making a special appeal today to national stakeholders, community leaders, response partners, and member states. Stay engaged and sustain this effort. Let us ensure that there are sufficient resources to eliminate the disease and ensure recovery. Let us continue to stand with the people of the affected countries at this vital time. We count on your continuing support and leadership. Thank you very much, Mr. President.
I thank